just so that way you can have access to it. So yeah, as I said, edema, we're just talking about fluid in the space. If it pits, it means that that fluid is causing a little indent, and the higher degree of the pitting, the longer that little indent stays. Um, is there any other questions about like the physical assessment, what to do?
Can we like go over the process of like um most more so for a focused assessment?
Which focus assessment? Like, there's a lot you could do a focus, cardiac, things like that.
Well, I don't think we got that deep into it. I think we just like did a general understanding of the focus assessment. So if we didn't do that, do you think we wouldn't have that like, on the exam, or they would expect us to know?
I don't think they would expect you to know that yet. We could definitely, like, if you have questions about things, we could definitely go over it. But for example, right, I think something that would relate to this focus assessment is that you always do right inspection, palpation, percussion, and auscultation in that order, right? One, two, three, and four. But for the abdomen, it switches. It becomes inspection, auscultation, palpation, percussion. Those switch. The reason it switches is that, sorry, it's percussion, palpation, my bad. Um, but yeah, so the reason it switches for the abdomen is that let's just say we're trying to feel for a mass, or let's just say they're having an impacted bowel, and we want to make sure that we can hear properly what's going on in the stomach. So inspection means I'm just looking, right? I'm seeing what's on the surface without doing any sort of touching. But auscultation means that I'm listening. I'm listening for something. So in that sense, if I'm going to be listening, the stomach requires listening because the sounds can tell you a lot. Is it, fast-paced bowel movement sound? Is it slow? Is it normal? Is there no sounds after auscultating for like a minute? So that's why you want to do auscultation first, because if you palpate and percuss, you could actually change the sounds in the stomach. So we want to auscultate first. So I definitely think they would ask you that. Um, what else? I would also think they would ask in terms of auscultation, right? Like simply what side would you use for what, right? So if we're talking about the diaphragm and the bell, there's two different parts. So the diaphragm is that bigger part and the bell is the smaller part. So when we're looking for, let me just double check. Um, I believe you can correct me if I'm wrong, but it should be the higher pitch sounds, you hear them with the bell, and the lower pitch sounds you hear with the diaphragm. You can correct me if I'm wrong, because I'm trying to find it in my notes somewhere and I'm struggling to find that. But um, typically, I think that's the way. Um, Sorry, it's reversed. The bell is for lower frequencies and the diaphragm is for higher frequencies. Okay. I always got that confused. But yeah, I would definitely know that. I would know that which part of the stethoscope does what, because that's how you um would know how to use your instruments properly when you're doing an assessment. So I definitely could see them asking a question like which part of the stethoscope do you use for what, right? Like the diaphragm, that bigger part, I use when I'm listening to the lung sounds and the heart. And when I'm talking about, like, let's just say I want to hear something a little smaller, like maybe a murmur or something that I can't really hear with that diaphragm, I'm going to switch and turn to the bell so that I could hear those, maybe like a murmur or a bruit or a thrill, something that you might not be able to hear. You could also palpate a thrill depending on where it is. Um, but yeah, so I would say knowing that for your focus assessment. Um, is there any other questions?
Not really, no.
I would also know the technique of each of the steps for a physical assessment. So, like with percussion, right, you're more or less tapping on that third finger. That's definitely really important on how you perform this technique as well as what you're looking for, right? So, you're looking for um, resonance or is there dullness, right? So, you're going to see when you're doing your physical assessment that certain parts of the lung or the heart you expect to see different things. Um, so I would definitely know that percussion, I'm looking for resonance or dullness because I'm looking for sound waves when I percuss. I'm here for an hour. So if there's any questions that you want to ask me, I would definitely take the most advantage of that. Um, but I totally get if you don't. I just want to give you all the opportunity. Um,
Is there anything that you think that like is like makes someone would make a common mistake doing something like confusing something maybe?
mm, I definitely think you could get confused between, I guess, palpation and percussion. Like knowing that with palpation, I'm more or less looking for that like superficial masses sort of thing. And that you could also use the ulnar surface to detect vibrations. Um, Also something that I've seen in a general like focus assessment is that if you want to like look for temperature, you use the back of your hands, not your palm, because your palm already has like temperature radiating through it. So it wouldn't be beneficial to use the palm of your hand, but the back of your hand doesn't. So you would be able to more accurately feel someone's temperature. I definitely think that's like a common question that could be asked. Um,
And then as for the acronyms, there's a few of them. Would they be like say, you know, A B C D acronym? What does the C stand for? Would there be questions like that?
like on your exam, if you've seen acronyms in the textbook, are they going to use them? Is that what you
Yeah,
mean?
yeah. Or would they like work it into like a work study question, like basing it off the patient, like what would you look for when they come in not being able to
Yeah,
breathe?
it's going to be more like they're not going to use the acronym. I've maybe once I've ever seen them use they might say like, "Oh, what's the order of like the physical assessment?" But I never really seen them actually use an acronym that they give. Like, for example, on a skin assessment, right? And you're looking for moles, they have something like the ABCD. And you might know ABCDs, but they're not going to be like, what is A? They're going to ask you to apply what you know. So, like, they might say, oh, a patient comes in to the office and they're coming in for their annual and the nurse is performing palpation. What is something that she could be looking for, right? I'm looking for maybe a warmth or tenderness or lymph nodes. Pulses also, you can palpate pulses, right? Like your radial pulse. They could definitely ask you about that. Palpating for pulses is an example of palpation, right? So when I'm looking for my radial, if I'm looking for what else? The tibial, if I'm looking for your temporal, like the different types of pulses, that's also a part of palpation. But it won't be as direct as just showing the like acronyms and things that they give.
I just feel like I just need some practice questions.
I totally get that. I definitely think the questions is the hardest part transitioning from now to your new nursing classes because it's like, oh, they've all had their own way of doing questions, but nursing is different. It's a different type of question set. But almost all of your questions, at least for now, in this particular class are going to be more oriented on do you know how to perform an assessment or like what do I assess for, right? So when you get to cardiac, there's going to be an order to auscultate heart sounds. There's going to be an order to say, okay, like where would I hear this? Where would I hear that? And those are sorts of things that they're going to be asking you. I wouldn't focus too heavily on all of the little details, which can be really hard, but I would focus on like what is the general steps for an assessment for this system and like know how to do it for that system, like what the order is, what it might look like. They could definitely give you diagrams as moving forward on like what is the correct placement of the stethoscope if I'm looking for this. They could even show you on this exam questions and ask you which is an example of palpation, what is an example of percussion. So I would definitely know like what those look like, especially from the textbook. If they have an example, like I would screenshot that example and put it in your notes somewhere.
I have a question. It's
Hmm.
about the nursing process.
Okay.
So it's assessment, diagnosis, and then it's outcome identification, and then it's planning, and then it's implementation and evaluation, right? So for implementation, that's the one that I guess that you there's basically a goal that the nurse, creates for the patient, right? That so I could put it into work,
For implementation,
right? Implementation
I'm
in
trying
a
to see if I
way.
could. Um, let's
Because
see.
I'm
I'm
just
trying
getting
to find.
confused with outcome identification and planning.
Okay. So, basically you have ADPIE, right? Or
Yeah.
ADPIE. So I don't, oh, I see it here. Okay. I was trying to look for it somewhere in the notes, so at least I have something. Okay. So here's the thing. So with planning and implementation, it can almost seem confusing because they're intertwined in the sense that I have to make a goal or something that I want this patient to achieve.
Right.
And then I have to implement that goal and implementation. So let's just say, usually a goal would be like patient, it has to be realistic, right? They could honestly ask you this. Like I'm being so serious. Like they can give you which of the following would be an example of the planning stage, which of the it would be an example of implementation, right? So planning would be like patient patient will ambulate um in 24 to 48 hours post-operatively, right? That's a goal where it's measurable. This patient could achieve it, and it is normally a goal for a patient to ambulate after a surgical procedure as soon as possible. Another example of planning would be it could be short term, like that goal, right? Very immediate, or a long term, which would be let's just say a patient goes home on warfarin. Warfarin is a medication that requires a lot of blood work follow-up because it's an anticoagulant, which means it prevents clots from forming. So we need to look at blood work closely. So it might be patient will follow up with provider in 1 to 2 weeks after discharge regarding blood work treatment. So that would be an example of planning. Implementation would be more of what am I doing as a nurse? What am I performing? So an example would be nurse helps patient ambulate, right? So the plan was to get them, let's say, ambulating. So my implementation would be the nurse ambulates the patient in the hallway. That's something that I'm doing. Or I give a medication. I perform wound care. I do this. Something that I'm doing as an action would be an example of implementation.
I was reading through like Jensen, and it was saying like if let's say you give the patient a medication and then you ask them like the rate if it's like good or bad, and then it's saying that the medication isn't working, where can that go in the nursing process?
So since the
Evaluation.
nurse is giving the medication, it would be implementation. Now, if okay, it's kind of tricky because you kind of have, I see what you're saying. There's also evaluation in there. If
Yeah.
it said, like, if the question were to say, the nurse gave a patient the medication, whatever it is, and then they asked the patient to rate their pain after 30 minutes of getting that medication. That's evaluation because even though I gave them the medication, that was 30 minutes ago, and I'm coming back to see if that pain medication worked. That's an example of evaluation, or coming back to see if they're feeling better from whatever they were supposed to get. So yeah, it would be tricky. It depends on how it's worded. If it were to say the nurse is coming in to give a medication, um, and they were just talking about all the things they did while being there with the patient to give them this medication, that would be implementation. If it said, oh, they come back and they want to find out, hey, did that anti-nausea medication work? Or can you rate your pain for me from 0 to 10? After getting a pain medication 30 minutes ago, that would be evaluation because I'm trying to see, did whatever I do help them?
Okay, so basically, like most of these questions would be mostly like critical thinking questions that will be asked
Yeah.
in a
So for
way.
example, exactly. Yeah. So if they said,
Mhm.
what's an example of assessment, right? So if they said they just listed vital signs, that would be an
Yeah,
example of assessment. Or
it's not physical.
let's just say subjective data. I don't know if they would put subjective data into that, but they could say like, oh, the nurse comes into the room, um, and is, asking them questions, and the patient states like, oh, I have a past medical history of diabetes and
Mhm.
high blood pressure. That would be assessment because the patient is giving you assessment data. They're giving you something
Mhm.
about themselves. Diagnoses would be probably relatively an easier one to pick out because it usually would be like a nursing diagnosis or identifying the problem. So an example would be like, um, uh, risk for falls is an example of a nursing diagnosis.
Mhm.
Um, that would be in the diagnosis phase, or
Can you use
impaired
it
gas
as
exchange. Hmm?
Can you use it like clinical, like the nurse clinical judgment, whatever? So like they say, shortness of breath, then they'll say something like I don't know like the medical term of how they will say it, but um
If the question said
like
patient has shortness of breath, I would pick assessment because they're telling me something about them.
no, but like I'm saying like how do you put that in a like on a medically how would the nurse say that if she diagnoses that?
So if you're saying if the question were to ask, oh, a patient comes in with shortness of breath, like what kind
Mm-hmm.
of I think it could be a few different things. It could say, ineffective breathing pattern. Uh,
Right. So that could be a diagnosis a nurse can like,
yeah, so an example
yeah.
for like respiratory, yeah, and that maybe
Hmm.
impaired gas exchange if they have COPD and
Yeah.
that's why they're having shortness of breath.
Mhm.
Ineffective airway clearance, let's just say they're choking and that's why they're having shortness of breath. Um, but definitely if they were to give you that, like, oh, like you said, right? Let's just say they have shortness of breath. They're not going to give you all respiratory. They're going to give
Yeah.
you like, okay, risk for falls,
Okay.
ineffective breathing pattern,
I
impaired
have a
gas
question.
exchange, I would say no for if
Mhm.
unless they said
Okay.
they have COPD, I would say no,
Right.
but I don't think they give you more than one respiratory as a choice if you're trying to pick a diagnosis that relates to that problem.
Mm. Okay. So like ambulating, like when you said ambulating, that means walking, right?
Yeah, yes, ambulate
Okay.
means to walk.
Okay.
Um,
Okay. Mm.
they could
Mm.
they could definitely ask you on your exam, like as we've been talking about, an example of a diagnosis that relates to that problem, or I don't think they do short answers. I hope not. But like,
Mhm.
how would you write your own nursing diagnosis for the situation? I don't think
Mhm.
so. Um,
Okay, good. Not
uh,
yet.
but let's just say the patient is post-op, right? So they're post-surgery, and we're talking
Mhm.
about ambulating, right? And the provider's like, okay, they're saying, oh yeah, the provider said they can be ad lib. Ad lib is a fancy way of saying the provider says you're good to walk. Um, and they're like, which diagnosis could be right a part of this person's care plan, and I would pick if they're walking, they're at risk for falls, so I would pick something that
Mhm.
would say risk for falls related to um, post-operative surgery. Like
Right.
it would be something like that. It would relate to the question itself, though like I said, what could be tricky, which would be more or less respiratory, because COPD is where you have impaired gas exchange. It might not
Mhm.
necessarily be like ineffective breathing pattern, but I think because this is going to be your first quiz, they're not going to throw 15 different things at you. It's going to be a simple, if they have a respiratory problem, I'm looking for a respiratory diagnosis. But it depends. Are they asking you which would be an example of assessment, or what would be a good diagnosis, or what would be a plan, right? An example plan for a patient that has, post surgery, right? Um, but I think it would be more or less being able to identify what comes from each category. So what is an example of planning? What is an example of a diagnosis? Which of the following would be an example of assessment? It could even be a select let apply and say which of the following are subjective data findings versus or they could say objective assessment findings, and then you select which ones relate to that um, topic.
Okay. Mhm. For the type of nursing assignments, there's a lot. I'm just confused with the physical assessments because there's head to toe and then it's functional and there's the body systems. So for head to toe, is that when they're like basically like going through everything, through all the body systems and they're like trying to do inspection, all those palpation, percussion, auscultation, right? For head to toe?
Basically, head to toe is everything, right? So head to
Okay.
toe is looking at their neurostatus all the way down to their musculoskeletal status. You're looking at everything. Um,
Okay.
Whereas a focus assessment would be, I'm looking just at respiratory, right? Like here's an example.
Okay, yeah. Hmm.
If a patient comes to the ED with shortness of breath, I'm not going to assess everything. I don't care about their skin. I don't care about their cardiac
Hmm.
status right now because I'm worried about their their respiratory status. So in that situation, um, I'm going to do a focused respiratory assessment.
And then for
But
like functional, I got confused with functional assessment. I
I'm
think I
trying
know
to
this number.
find that in my notes. Functional assessment. I don't really see that in my notes. It might be in the beginning. See, I have comprehensive and complete physical, which means the same thing. Head to toe and comprehensive is the same thing. So don't if you see comprehensive and you see complete physical exam, it's used interchangeably. I don't have functional. The types of assessments I have are focused, like I said, example of, like this is for a situation where a patient's not new. So you focus on a specific thing. So like when you go to your doctor, right, and you have a cold, they're not looking at everything. They're just going to treat you for the cold. That's a focus assessment. But that patient's not new. If it's a new patient, you do that comprehensive. Or like when you go get a new primary doctor and they do your annual. Ongoing is a type of assessment that you continue to evaluate problems on a regular basis. This is somebody you continually do assessments on. An emergency would be a life-threatening situation. So an emergency assessment would be somebody's coming in for cardiac arrest. So I'm definitely going to be, doing an assessment on, cardiac status, getting blood work, getting an EKG so I could see what's going on in their heart. And that would be an example of an emergency. I'm going to do an emergency assessment, which would be, is there anything really going on other than, this patient really going into cardiac arrest? And you're going to focus your treatments on getting them out of cardiac arrest. But I don't have functional. I'm not really sure what that is. I wish I did. But yeah, I don't have that one. I definitely think they could ask you the types of prevention and Maslow's hierarchy of needs. This one's an important one because it comes up over and over again in every class, and types of prevention comes up a lot too. So basically there's 3 types of prevention. Unless I could stop if there's any more questions about anything we just spoke about. I don't want to like derail if there's anything else you guys want to ask.
I think it's fine.
Okay, I just want to make sure because I don't want to like not answer anyone's questions. But yeah, so there's types of prevention, right? So there's primary, secondary, and tertiary. I could definitely see them asking you to identify an example of one of those. So primary means that if I'm going to do primary prevention, that means I don't have an illness. They don't have anything. And the way that we can prevent someone from contracting an illness and using this primary prevention model, they don't have it yet. How can we help them? Well, the only way we can help someone who doesn't have any illness or risk for illness, right, is education. So education would be an example of a way to promote primary prevention. Whereas secondary prevention is, let's just say they have the illness, or like they have, let's just say they hurt themselves, right? They just broke their leg or something like that. Or this is before and they are being screened, they're at a pre-diabetic state. They're not diabetic yet, but they are having some sort of illness, right? So we can do screenings, right, as a way to see if they have these said illnesses. So secondary means that they have it, but it's temporary. We can do stuff and we can perform treatments to get rid of that acute temporary problem.
So it's basically like, sorry, I'm so sorry for cutting you off.
No, you're good.
So basically for secondary, it could be like an early diagnosis of like the health problem, like just an early little diagnosis, and like you just give them treatment just to prevent further complications, right?
Exactly. So
okay.
It's like they don't have it really bad yet, but we could do things to get rid of it. As you said, early. Tertiary is that late, right? So now they have chronic diabetes. Let's just say, they didn't control that sugar. They didn't do what they needed to do, and now they're diabetic. And now they need insulin treatment, right? Or rehabilitation because let's say they broke their leg so bad that now it got to the point where we need to have more long-term goals for these patients, and we need to provide care that's not going to fix the problem, but enhance their quality of life. So yeah, you hit it right on the head, right? Secondary is this early, and tertiary is this late sort of chronic illness, whereas secondary is something more acute, and primary means they got nothing, and we want to do everything that we can to prevent them from getting something.
I have a question. Hello?
Yeah.
Yeah, I have a question about that. So, is the primary, secondary, and tertiary only for chronic illnesses, or could that be related to anything outside of that?
It could be anything, but like tertiary itself is more or less something that is chronic or that becomes a long-term problem. Secondary is anything that's acute or an early diagnosis for something. So we could do treatments to prevent it from getting to tertiary. And primary is they have nothing. So we just want to provide them education, right? So let's just say when you have a sexual harassment training, right, at a college, that is primary prevention. The idea is to educate people so that this doesn't happen, or sex education, right, on the use of condoms and things like that. That would be an example of primary, to help people not contract things before they occur. I hope
Thank
that
you.
answers your question.
Yeah, it did. I have another question, but it's not related to that, if you don't mind.
No, I don't mind.
For the communication techniques, we have the two that confuse me is elaboration and clarification. Can you tell me the difference between those two?
Okay, so let's just say a patient, they're telling you their patient history, right? They're giving you something and they're telling you a story about themselves. You said the difference between elaboration and clarification? Is that what you just said?
Yeah, elaboration and clarification.
So let's just say I want to clarify, meaning, okay, so they tell me, oh, my husband just passed away last week, and then so did my dog. So I would clarify and say, so both last week, your husband and dog passed away? Whereas elaborating would be, okay, so tell me more about what happened during the week that your husband and dog passed away. I'm trying to find more information with elaboration, but clarification is more or less, I'm trying to make sure I understand what they're saying. I hope that makes sense, the two examples I provided.
Yeah, that's great. Thank you.
Okay. Is there any more questions about anything? Because definitely I think Maslow will 100% be on your quiz if there's no other questions. I take silence as no, usually.
Wait, so for Maslow's, what do you think they will ask us from it?
Definitely they will ask you how to identify what would be in each part. So Maslow's hierarchy of needs is like this system where it allows us to prioritize our clients' needs. So it's like a pyramid where the bottom is the most important needs, and then they get, not that they're not all important, but the lower ones are more important than the higher ones, right? So for example, I need air, water, and food to live. If my patient doesn't have that, that's a problem. So that is my priority in a situation B, which are the following would be my priority to, help my patient with. Well, it would be if they're telling me that they don't have access to food or clean water. The next thing is, let's just say physiological needs isn't a problem. They have air, they have water, food, shelter, sleep, clothing. They have their essential basic needs. The next thing would be safety needs, right? are they able to get around their house or wherever they go? Do they have employment, health insurance, things like that? If safety isn't a problem, then I go to love and belonging. Do they have friendships, support systems? Do they feel like they belong in their community or with the people that they care about, right? That's another need. If that need is checked off and they have that, then I'm going to go to self-esteem. Does that patient have respect for themselves, right? Do they feel good about themselves? Things like that. And then the highest and the thing that we want all of our patients to be at is this self-actualization, which is a desire to be basically your best self. The highest potential that you can reach as a human being, we want you to get there. So examples might be, using Maslow's hierarchy, right? What would be example of physiological needs? What might be an example of safety needs, right? What might be an example of love and belonging, things like that.
If your patient is food insecure, that'd probably be the physiological need.
So if the question said which would be an example of, physiological needs, and they said, oh, I don't have any food. Yes, that would be the one I would pick. Or I don't have shelter, or I don't have basic essentials, right? Things I need every day, which is pretty much air, water, food, and somewhere to sleep and keep myself safe. And then safety needs are not like the same way that I might need shelter, but it's more like personal security, right? Do they have money? Are they able to get around their house, right? Are they safe from harm? Things like that. Love and belonging would be, do they have friends, family? Are they connected to them? Do they feel loved, right? A self-esteem issue would be like, you know what? I don't really always like myself every day. That would be a self-esteem sort of point if, well, answer choice to pick if they were to say what's an example of a self-esteem need. I've never really seen self-actualization being asked, but usually they would just ask to identify it, which is just becoming your best self. But I guess an example would be like, hey, this patient says that, they've were able to like achieve all their goals and they feel really fulfilled in life. That would be like self-actualization.
I have a question, but it's not relating to the Maslow's hierarchy.
That's fine.
It's more so it's like on it's basically chapter 3 of the nursing skills assessment. Do you think that on the first quiz they'll talk about this? Because I know we're talking about the PPEs, like for the gowns, the gloves, and all that. Do you think that she might ask us questions about the standard precautions versus the transmission precautions? Because that's also part of the therapeutics, class.
Yes, I think if it's in the chapter or if it's in the chapter that's a part to be on your quiz, I definitely think that they would ask you because it's such a common NCLEX sort of question. Like with standard precautions, a question might be like, what should, the nurse know based on using the standard precautions model, right? Like you're supposed to consider everybody infectious. Nobody's supposed to be considered clean, everyone is infected, and that you always need to wash your hands, right? And you always need to wear gloves when you're going to interact with the patient. That's all that the standard precautions, and definitely transmission based, right? Like what do you do for Droplet? What do you do for Airborne? I don't know if they said that you would have to know the examples of each. That could be tricky because there's definitely a lot of them, but I would definitely know, especially Airborne. There's only like 4 of them for Airborne that are very commonly asked, and I would know what types of PPE I need to wear if I'm going to go into an Airborne room. And they might not even say like, oh, Airborne. They could say a person has tuberculosis. and what
Mhm.
sorts of PPE should I wear? Well, I should be wearing an N95. That's something for airborne, and that patient should be on, I believe, you can correct me if I'm wrong. Yeah, isolated. They should be by themselves, and they should have negative pressure, air pressure in the room. I think it's negative.
Yeah.
Yes,
Because
because
of like
negative.
reventilating it, or I don't know, I think it's the word, like, changing the air in the room or somewhere.
Yeah, you're trying to change the air pressure so that instead of it
Yeah.
going into the room, their germs are leaving the room. Um, but yeah, so they need to be in negative pressure rooms. That's something I would know, right? Like measles, varicella, or chickenpox, and herpes zoster is examples of airborne. Droplet is pretty much everything else that's like colds, flu, pertussis, uh, diphtheria, which is just another type of respiratory problem. All of those are droplets. So they could be in the same room with a patient who has the same um, illness, and you don't need an N95, but you do need to wear a glove of not gloves, gloves too always, but a mask, a regular surgical mask when you're coming in contact with that patient. Um, for contact,
Um,
hmm.
oh, sorry. You can go.
No, I didn't know if you had a question, so that's why I didn't want to like continue.
Oh, no,
Um,
no, no.
contact is like MRSA, C. diff, because usually these are like either on their skin, these illnesses, or they're like in their poop, or their feces. So, in this situation, you don't need a mask because they're not droplet, they're not going to spit on you and you're going to get it. But if you come in contact with their feces, that could be a problem. So it's usually gowns and potentially a shield, depending on what you might do and if there's any sort of like blood that can come out on you, like a face shield. Um, but yeah, definitely you have to don that gown because you're going into a room where, like I said, it's usually the feces that's contaminated. So, um, and for immunocompromised patients, right, they have positive pressure rooms. You have to wear a mask when you go into those rooms, and they should wear a mask when people come in because they have a weak immune system. So, anything that somebody has, they could catch. And also something that they could definitely ask you, which I would think would be probably a gimme question, would be like, what should you do before you enter a room, or what's the best way to prevent infections? And that's the answer is always hand hygiene. You should always wash your hands, and you use alcohol based um, like hand sanitizer if, let's just say, there's nothing on your hands, right? So you took off your gloves, there's nothing on you, no visible anything, you could use hand sanitizer. But let's just say, like I said, you're in that room with that C. diff patient, something like that, you would want to wash your hands with soap and water. Um, so usually they say if your hands are visibly soiled, meaning there's something on them, then you use the soap and water method. If not, then you use hand sanitizer. I think that pretty much summarizes transmission-based precautions. Um, can't really think of anything else for that unless you have any questions.
For a patient with MRSA,
Uh-huh.
the methylene resistant, that one is a contact one?
Yeah.
Would it be contact? Okay.
Yeah, it's like I've never seen it. I've heard it before. I think it's also a poop related thing. Also lice, scabies, that's all contact. That's because like something on them, right? That's why I got to gown up, put your hair up, sort of thing. Um, what else? Trying to think. Like, okay, the reason why, is there a question?
Yeah, sorry. So for airborne, you would have to PPE would be wearing a mask, gloves, and then anything else or
For airborne, it has to be an N95. It can't just be a regular surgical mask. Everything else could be a surgical mask except contact. It's not a necessity to have a surgical mask for that, but droplet surgical. The reason being is that airborne, like tuberculosis, varicella, measles, or herpes zoster, those ones they're airborne, so they have something called a droplet nuclei, which means that when they spit or talk, that droplet, that nuclei stays in the air longer than if you were to have a cold, right? So, and that's why with those patients, you want to wear an N95 because those respirators that you put on, they protect you from those particles that they have in the room.
Thank you.
So, yeah, N95 airborne precautions. That's always there. I mean, gloves is for every patient, but it's always the idea is like, what do I do a little bit differently for each patient? And it's, well, N95 is for airborne, and I need to make sure the room has negative pressure. And always for airborne, droplet, and immunocompromised, if they're going to leave the room and they're going to go somewhere else, they should wear a mask. Like the patient themselves should have a mask on them because they could transmit something, or like those immunocompromised patients can get something. So we will tell them to have a mask if they're going to leave the room.
I have a question about the Maslow's hierarchy. When we get questions about the hierarchy, do you think like the questions would be formed as like what are the components of Maslow's hierarchy, or would it give the example like how you asked us an example of physiological needs?
Definitely example. They're never that easy, and unfortunately, it's always like thinking about the situation. It's always critical thinking. It's never just, I mean, they could give you an example in a question and have you identify it like picking a multiple choice answer, but it won't be like, what are the components of Maslow? If they do, that's a great question to get on your quiz, I think.
Thank you.
Oh, just in case, I forgot to mention this. If you could put your SFC ID numbers into the chat for me. I forgot to mention that. But okay, I'm gonna stop the recording here.